Hi, today I want to talk to you about exercise and its relation to pulmonary disease. Now, I know when you hear the words exercise and pulmonary disease together, it may frighten you just a little bit. But I wanted to let you know that exercise is actually vital to the long-term survival of people with pulmonary disease, okay? So in this video, I'm going to tell you the importance of it, and I'm also going to tell you how to do it. Now, what I need to tell you first off is that you should never begin an exercise regimen or program without consulting your healthcare provider and getting the okay from them, okay? That is so important. It's also important that if you have lung disease, that when you do begin to exercise, you do so in a controlled and safe environment where you can be watched, okay? This is supervised exercise, which you can find in pulmonary rehabilitation programs. So again, don't try to start exercising on your own, but I am going to tell you the importance of why you should be, okay? Now, exercise is important for anyone with pulmonary disease, and that includes advanced lung disease. What we do with that is, obviously, I'm not going to have you running on a treadmill, but we would start wherever you are and try to build you up from there. Now, the importance of exercise. Exercise, of course, strengthens your muscles, it strengthens your bones, essentially strengthens your body. Well, when your muscles are strengthened, they utilize less oxygen when you use them, therefore making your body more efficient at using oxygen. So those of you who have trouble breathing and sometimes suffer from low oxygenation, you can appreciate this more so than the average person. And that's because you need that oxygen. You need all of it. You don't want your muscles wasting oxygen. You don't want your body wasting oxygen. So you need to condition it through exercise. Now, essentially, aerobic exercise is what is going to condition your body. But here in pulmonary rehab, we also do light strength training. And this is because you want to get your muscles stronger so that when you utilize them on a day-to-day basis, it makes activities easier for you to do, and while you're doing them, you're using less oxygen due to the increased muscle mass, okay? Now, some other benefits of exercise is that if you have trouble sleeping at night, it can improve that. It helps people sleep better. It also gives you endorphins. Therefore, if you're suffering from depression or maybe it's not as far as depression yet, but you're just not happy, kind of sluggish, that's going to help you too because you're going to get energized and in general, you're going to feel better. Your mood will be better. It also helps reduce stress, tension, and anxiety, and those things pretty much accompany anybody who has pulmonary disease because it can be very stressful. And then, of course, just the fact that you have trouble breathing, that's going to lead to anxiety at some time. So exercise can kind of hit that or stop that where it starts. Also, it's going to help reduce body fat. Now, some of you may be super skinny and not have any body fat on you. Now, for those of you that are those people, you will basically build muscle. Now, if you are overweight, when you exercise, you're going to lose some of that body fat, okay? Now, I tell most people that muscle weighs more than fat, so once you start the program, if you notice that you're gaining weight, more than likely it's muscle that you're gaining and not actual fat. So the fat content is what we're worried about. Anytime you're carrying around extra weight, that is extra stuff that your body has to do. So if you're getting up and walking around and you're carrying an extra 10 to 50 pounds, your body has to work much, much harder. It's going to use more oxygen and it's going to make you more short of breath. So one of the best things you can do for yourself if you're overweight with pulmonary disease is look into maybe some nutritional changes that you can make in your diet and try to lose some of that weight, okay? And then another thing that it does is that it increases your endurance. And so this is going to be helpful when you go like to the store or you're going to visit family, going out to lunch. You're going to be able to get through those activities much easier than before you started exercising. Now, in here, in my pulmonary rehabilitation program, you are on a cardiac monitor as well as a pulse oximeter from start to end. And I'm here to walk you through and to supervise you and make sure that you don't overexert yourself and that you stay safe, okay? So I know that it sounds kind of scary to probably everybody, but you are in a safe, controlled environment here, and that's with any pulmonary rehabilitation program. So if this is something that you think you may be interested in, all you need to do is make an appointment with your family care physician and then mention to them that you think you could be helped with pulmonary rehab. Now, a little fact that I found out just the other day is that pulmonary rehab is one of the most beneficial treatments for patients with COPD and other lung diseases, and it is also the most underutilized therapies for patients with COPD and pulmonary disease. So that's kind of crazy, because you have something that is the most beneficial linked to the most underprescribed. So I'm here to get the word out that here in Harrodsburg, Kentucky, we do have pulmonary rehabilitation. My number is on the Facebook page, so you can call me if you have any questions. Also, I'll be posting this to my YouTube page, One Breath at a Time, and you all can always ask me questions anytime, and I'm here to answer any questions that your doctors may have, and just help you through the process of trying to get better. So I'm going to end on that, and the next video I'm going to go through medications, and so I'll see you then. Thanks.